go ahead and get started. Thank you for joining us for our webinar, the Community Needs Assessment on Comprehensive Cancer Control, Future Directions for Technical Support. My name is Mandy Pratt-Chapman. I'm the director for the GW Cancer Institute, and I'm principal investigator for a cooperative agreement through the Centers for Disease Control and Prevention that helps the GW Cancer Institute provide technical support to comprehensive cancer control programs. This is what I'm going to cover on the call today. I'll give you an overview of the GW Cancer Institute as well as the Technical Assistance Project. I'll share the results of our needs assessment for the project, and I'll also be happy to take questions at the end of the presentation. This is a little bit about the GW Cancer Institute. We were founded in 2003, and our vision is to set the standard for patient-centered care and eliminate cancer health disparities. We do this our mission is to ensure access to quality patient-centered care across the cancer continuum, and we do this through community engagement, patient and family empowerment, healthcare professional education, policy advocacy, and collaborative multidisciplinary research. In September of last year, we were awarded funding to provide technical assistance to enhance comprehensive cancer control efforts. This award is in addition to a separate award that has been given to the American Cancer Society, and we're working very closely with them to coordinate efforts and ensure that we reduce overlap or any duplication. These are the main activities we have planned for our 5-year project. We will leverage our online academy to build free online trainings for comprehensive cancer control programs. We're starting with our executive training on navigation and survivorship, which is a nuts and bolts training on creating and sustaining patient navigation and survivorship programs. We're also providing a competency-driven patient navigation training, and each year we'll add additional courses. We started with these 2 topics because they were popular courses that historically have been held in person at GW. We're also going to be working on resource guides for a variety of topics. Our first guides will focus on coalition structure and stakeholder engagement, and these topics arose from our steering committee and based on this needs assessment. Another key activity is connecting comprehensive cancer practitioners with each other and with experts. We're building a database of experts right now to facilitate matching, and we're building an online resource repository to facilitate sharing of best practices. We've also partnered with the Area Health Education Centers, or AHECs, to host a total of 15 roundtables over the course of our project. The goal of the roundtables will be to discuss challenges, successes, and opportunities for strengthening cancer and chronic disease prevention integration efforts at the local level. If you're unfamiliar with AHEC, the organization has chapters in nearly every state that focus on increasing access to quality health care through public health workforce development. We will also be providing large group, small group, and one-on-one technical support. Our large group TA will start with a monthly webinar series and a monthly e-newsletter that aggregates technical support opportunities. Our small group TA will focus on providing more direct access to experts through a webinar platform. Currently, we're doing one-on-one TA by request and based on staff capacity. Finally, we're creating a tool to help comprehensive cancer control programs align local initiatives with national priority health indicators. We also established a steering committee to help guide our activities. The steering committee members serve 1-year terms and meet quarterly by telephone. Members include program directors from cancer control programs, as well as staff, AHECs, public health faculty from GW, and the CDC. To make sure that what we have planned is aligned with comprehensive cancer control needs, we conducted a needs assessment that included these activities. I'm going to go through each activity today. So we conducted some key informant interviews in June of 2013, and this consisted of comprehensive cancer control grantees and coalition members in 7 programs. Interviewees were asked to identify types of technical support that would be most beneficial. And these were our findings. Key informants expressed wanting the following types of technical support: sharing of best practices and translation in their own communities, training related to cancer plans and their implementation, implementing policy systems and environmental change approaches, increased mechanisms for connecting with other programs, sharing best practices, and more assistance with translating best practices in their own communities. information on research methods and evaluating impacts, developing comprehensive communication plans and long-term engagement strategies, additional opportunities to work more strategically with the national partners, additional communication vehicles to complement the already useful listservs, guidance on integrating cancer with other chronic diseases, and web-based programs due to current economic constraints. This slide shows you the breadth of technical support available to comprehensive cancer control programs. As you can see, there are a lot of existing sources for technical assistance. However, it was clear to us that many programs are unaware of all of these great resources. Technical support is offered through all of these formats: calls, conferences, forums, guides and plans, newsletters, policy tracking and surveillance, progress reports, recurring meetings, task forces, online education, on-site technical support, train the trainers, webinars, and workshops. We analyzed many documents and reports to help us better understand the needs of comprehensive cancer control programs. These reports and documents included those released by the national partners and other stakeholders, including the Legacy Foundation, the Partnership for Prevention, and the Union for International Cancer Control. We wanted to summarize existing technical support, needed technical support, known challenges, and opportunities for improving technical support. Documents included evaluation reports from national partner programs, project proposals from the American Cancer Society and the GW Cancer Institute, journal articles on comprehensive cancer control practices, and articles on evidence-based practices from the Journal of Public Health Management Practice and Preventing Chronic Disease. Meeting notes, such as notes from the last C-Change annual meeting, as well as special NIH meetings on special populations. Reports like the Legacy Foundation's Implementation Guide for Community Health Centers, and resources from the Association of State and Territorial Health Officials, as well as the National Association of County and City Health Officials. We sorted this information asking the questions: what are the existing TA resources for comprehensive cancer control? What are the needed TA resources? What are known challenges, and what are the opportunities? This slide shows the top formats and topics currently provided, as well as the top resource topics identified as needed. The top 5 formats, TA has historically been provided through the American Cancer Society and national partners through live meetings with telephone follow-up and sometimes live meeting follow-up. Online TA is also prevalent, especially webinar trainings and online education. A wide variety of topics are currently available. TA on implementing and evaluating comprehensive cancer control programs and evidence-based practices have been provided and mentioned as a priority going forward. The second most prevalent TA topic is on policy systems and environmental changes, and more specifically, how healthcare reform and the ACA impact comprehensive cancer control efforts. Other technical support is focused on communicating successful or promising practices and developing sustainable partnerships. Technical support can be provided for initiatives across the cancer continuum, from cancer prevention and early detection strategies to survivorship or systems change. In terms of need, there's still a need for TA to implement evidence-based practices, to improve stakeholder engagement, and to make sense of specific ways health reform will impact cancer care access and healthcare delivery in specific communities. Lack of funding or lack of secure funds is also a concern for coalitions. Notes from the National Partners Semi-Annual Meeting in November 2012 revealed that additional funding is needed for coalitions to implement plan priorities. Further, assistance in identifying federal and foundation funding opportunities, as well as TA on strengthening grant writing skills, were requested by local health departments in NACHA's report. Challenges identified were lack of capacity for comprehensive cancer control practitioners to implement activities, unclear goals and purpose of some technical support and cancer control plans, geographic barriers that make it difficult to travel to meet with other comprehensive cancer control practitioners, lack of reminders and follow-up for existing technical support, and technological difficulties with some TA efforts. Unclear goals refer to people feeling that they would participate in a call or a webinar and not understand its purpose or expected outcomes. The broad scope of comprehensive cancer control also makes it difficult for practitioners and coalition members to know where to start or what goals they should focus on. Our work on priority alignment will not be prescriptive, but we hope it will provide a framework to help focus coalition efforts and alleviate this confusion about where to even start. Many opportunities for technical support were identified, including the opportunity to strengthen collaboration across and within states, to leverage the use of evidence-based practices for cancer control, to target special populations more effectively, to increase funding for support for comprehensive cancer efforts, and to share and disseminate information across programs. While we can't address all of these needs immediately, this is really useful information to help us prioritize our own efforts to support you. The national partners, which we will highlight on our next webinar in July, provide technical support for comprehensive cancer control programs in a variety of ways. To better understand their perspectives on coalition needs, we conducted interviews in March 2014 with representatives of these national partner organizations. Through the interviews and learning about the activities of the national partners, the following themes emerged. Coalitions and other key stakeholders need education and information on the wealth of coalition support organizations, including all the national partners and their programs and resources. This is really important to maximize the use of these already existing resources. A disparity exists between state-level cancer plans and the work coalitions are sometimes doing on the ground, creating challenges for coalitions about prioritizing their activities based on their capacity. Identifying, coordinating, and delivering targeted TA is critical. Creating a more robust understanding of coalition structures, functioning, activities, and priorities will inform this process. A cohesive community of comprehensive cancer control practitioners would benefit all. Providing more opportunities for coalitions to interface with each other and connect with the national partners and other key organizations is critical to building a strong community. Convening multiple stakeholders through targeted TA efforts fosters new relationships and team building, affecting positive results. And because cancer is a complex, multifaceted disease, and because of the myriad diseases and health conditions affecting so many people, it's an ongoing challenge for states, tribes, communities, and cancer organizations to select and dedicate cancer control efforts and resources at an optimal level. All of these needs remain a challenge since each community is different and technical support will need to be tailored to bridge these gaps. Finally, as a technical support partner, we're not able to specifically impact funding of coalitions, but sustainability is a clear and strong need. What we can do is help with skills building and dissemination of funding opportunities, which we've started to do through our monthly TA newsletter. To maximize impact on population health for cancer control programs and leverage the experience and expertise of the national partners, the following potential collaborative opportunities were identified. Grow and expand existing partnerships. Promote the Institute of Medicine report on quality cancer care and work to advance its recommendations. Specifically, this might include supporting efforts on patient navigation and cancer survivorship. Create goals to increase colorectal screening. Develop targeted trainings for coalitions. Leverage the vast number of existing resources for TA activities and increase efforts to collect, disseminate, co-brand, and cross-promote products and training. Facilitate relationships among comprehensive cancer control coalitions and between cancer control and tobacco coalitions. Facilitate relationships and strengthen the integration of comprehensive cancer control and chronic disease efforts. Facilitate relationships by pairing mentors and mentees. Facilitate relationships through online discussion forums, web portals, and other online resources for cancer control stakeholders. Present FaceTime opportunities for coalition and cancer control serving organizations. Strategically assess the needs of coalitions and deliver targeted TA. And develop tailored efforts to assist coalitions with implementation of the Affordable Care Act. We've heard consistently that the Affordable Care Act is something that comprehensive cancer programs need more information on, so we conducted an environmental scan to see what resources exist and where the gaps are. We looked at 31 organizations, including professional associations, state-level organizations, and other nonprofit organizations. This list is not exhaustive. We started with organizations like the Kaiser Foundation and looked for resources that were most visible and accessible. Findings from the environmental scan showed that webinars are the most popular format to deliver updates on the ACA. Guides and fact sheets are often used to communicate provisional updates or step-by-step processes of how individuals and organizations need to adjust and take advantage of health reform. Numerous news and media communication exists through newsletters, blogs, reports. And although there are many resources on the ACA, few resources exist specifically related to state-level ACA implementation and how cancer care in particular is impacted. During the discussion portion of this call, I'd like to hear from you about what would be most useful for you in terms of resources to address this technical support need. You can think about this for a few minutes and I'll come back to it. Many types of cancer are considered similar to chronic diseases because of similar risk factors and the significant survival of those diagnosed with cancer who are managing their health long term. The CDC has indicated interest in better integrating cancer and chronic disease prevention efforts. The CDC's goals for integration include creating efficient and effective chronic disease prevention and health promotion programs, reducing cost burden on individuals, businesses, employers, governments, and the nation, and improving health outcomes across multiple risk factors. The CDC piloted chronic disease integration efforts with 4 states and found that the top factors impacting integration were program management or leadership, federal funding, and realignment of staffing to support the approach. The top impacts resulting from integration include clarification of the chronic disease agenda, clarification of the vision within the chronic disease unit, and increased focus for work efforts. Every state must have a chronic disease plan, but at the time of our assessment, there were 13 publicly available plans, and all of them mention cancer as part of the chronic diseases that are among the leading causes of death, disability, and rising healthcare costs in their specific states. Some common cancer prevention methods referenced in plans include increasing screening for cardiovascular disease, diabetes, and certain types of cancers such as breast, cervical, and colorectal cancers. Some also reference national strategic goals such as Healthy People 2020. Social media has come up as both a tool for reaching healthcare professionals and as a tool for enhancing comprehensive cancer control activities. So we looked at 2 surveys conducted to better understand how health professionals prefer to receive information via social media. We conducted a survey last fall to assess how healthcare professionals use social media and how they use it for professional development. Many are using social media and they most often use it for news and events, as well as communicating and networking. Some use it for professional development. 59% find social media useful for professional development. And for professional uses, LinkedIn was cited as used most often, followed by Facebook. Twitter was used comparatively less for professionals who responded to our survey. Additionally, the Legacy Foundation disseminated a survey on social media during 2 coalition workshops held in August of 2013. One of the questions asked coalition members to rank their preferred method of receiving comprehensive cancer control information and resources. Here, 1 indicates the most preferred method and 5 indicates the least preferred method. The majority said that they would prefer to receive technical support through electronic newsletters, links to tools, as well as websites as demonstrated in this graph. We also decided to catalog existing newsletters and websites to help guide our efforts. So we looked at the Cancer Control Planet newsletter, the CDC's cancer-related news, NACCHO's implementation newsletter, and 16 federal or national partner websites were also analyzed. Our analysis of newsletters and websites indicated that content and functioning of the sites and newsletters was limited. So information was limited and at times it was outdated. Resources were credible and mostly produced by federal and national entities. There were, however, complex click-through mechanisms. So this presented challenges in terms of getting to the right information quickly. And then sometimes access to certain portions of the site were limited or proprietary. In terms of the national partner websites, there's a wealth of information, resources, and referrals for a variety of cancers and cancer-related issues. And these sites share important technical support activity announcements, data resources, and discussion forums for their stakeholders to connect. They also provide a wealth of links to other cancer-related resources, but there with complex site organization and content is sometimes a challenge to locate. In addition, comprehensive cancer control efforts, TA activities, and resources aren't cataloged in a single location, making it difficult for the practitioner to find what they need most efficiently. A few weeks ago, we sent out a survey to comprehensive cancer control program directors and coalition leaders to gather more feedback about your needs. We had 62 of you respond. I'm going to share the results of the survey analysis now and take any questions after the conclusion of this portion so that I can make sure that we're tracking with all of you. So again, 62 of you responded to the survey, and the majority of survey respondents identified as program directors. Other job roles included program coordinators, managers and specialists, coalition communicators or staff, cancer policy coordinators, cancer registrars, PIs, and partner program presidents. Respondents were given the option to select more than one profession, so the numbers add up to more than 100%. Most respondents were from state health departments. Other responses included nonprofits, Medicaid managed care organization, tribal health, AHEC, state coalition partners, community cancer centers, healthcare networks, and comprehensive cancer control programs. Respondents were, again, offered the option to select more than one profession. We asked participants for preferred channels for technical support. Webinar, website, and listserv were most often cited. Other channels identified were regional meetings or conferences or even regional calls, in-person meetings at least once a year, in-person workshops or meetings or conference calls, small regional groups with similar programs, and teleconference as well as one-on-one coaching. Comments that were included in the open section of the survey included not being familiar with research to reality or being blocked from accessing Facebook and Twitter at work, so that was not a feasible option for technical support for some entities. The most highly preferred technical support channels and frequencies were quarterly webinars and monthly e-newsletters. The greatest topics of interest included evidence-based practices and interventions at 76%, prevention of cancer and other chronic diseases at 70%, grants funding and capacity building at 65%, policy systems and environmental change at a 63% response, survivorship at 58%. Other topics that were indicated as topics of interest were LGBT cancer issues, technical support for Medicaid enrollees, development of survivorship care plans, and attention for populations with mental illness or substance abuse disorders. We asked respondents to rate their level of engagement with stakeholders as well as to rate their perceived level of benefit from engagement with different stakeholders. Coalitions were most engaged with community organizations and academic institutions. Coalitions reported being least engaged with AHECs and political decision makers. Survey respondents indicated perceived benefit of engagement with all stakeholders listed, and the national partners were seen as the most beneficial with which to engage. So the biggest gap you can see here is with political decision makers, and the second biggest gap is with AHECs, between perception of benefit and actual engagement. We asked respondents about different technical support activities. Web-based training and education and resource guides were most often cited as beneficial, along with small group web-based technical support and web-based train-the-trainer programs. The areas of greatest need indicated were policy systems and environmental change, survivorship, communication plans, evidence-based practices and interventions, information on the Affordable Care Act, program evaluation, and community-based participatory research. Technical support in these areas will help states meet their cancer control objectives. So now I'm going to give you some preliminary conclusions. Based on our needs assessment, we found that existing resources need to be effectively organized and easily accessible. We also want to address the gaps that we've identified in technical support offerings. The greatest needs for TA exist around the following topics based on your responses and our review of reports and documents to date. ACA implementation, especially at the state level, and especially in terms of how it specifically impacts cancer. Cancer survivorship, evidence-based practices and interventions, program evaluation support, coalition building and stakeholder engagement, policy systems and environmental changes, community clinical linkages, and communication of comprehensive cancer control successes. We want to enhance comprehensive cancer control activities and opportunities, as well as strengthen partnerships and increase collaboration with local partners, comprehensive cancer control national partners, and AHECs. Communication across comprehensive cancer control programs and coalitions is critical. Existing platforms exist, but there are gaps in the availability of channels that should be addressed. We need to focus on integration of cancer and chronic disease prevention to break down silos and help make sure that our efforts are focused and that we're using resources wisely. Social media are useful tools for reaching both individuals and healthcare professionals, and although there are benefits and drawbacks to online adult education, the format is cost-effective for addressing TA needs. So I wanted to revisit our overview for our technical support project, and based on these needs assessment findings, we do think that our efforts are on the right track. The needs assessment has also been helpful in narrowing down topic ideas for these activities as we move forward. Before I get to the discussion portion, I just wanted to thank the Centers for Disease Control and Prevention for their support of this project, without which we would not be able to provide this kind of support. So I now wanted you to unmute your lines, and I wanted to ask you a few questions to help guide our activities. I'd like to hear from you about what you would find most useful in terms of technical support. Do these results resonate with your coalition and program needs, and what would you like to see prioritized? So if you could unmute your phones and give me your feedback, that would be wonderful in helping to shape our efforts.
Hi, Mandy. This is Polly Hager from Michigan.
Hi, Polly.
I wondered, could you go back maybe to one of the slides that showed the different topics that came up so we could have a reference point?
Sure. So these are some of the topics, and these were some of the conclusions in terms of the greatest areas of need. So is that a useful slide, or are you thinking of another?
I think the one that you're showing right now is helpful, as well as the one that had the red and blue lines. Both of those are helpful just to kind of see what people were thinking.
Sure. So this kind of summarizes the higher level things that bubble to the top in terms of needs. ACA implementation, survivorship, evidence-based practices and interventions, program evaluation, coalition building and engagement, PSE, community clinical linkages, and communication of successes. And then this is the more comprehensive list and how it broke down in terms of those who have need are indicated in red. So the the longest red bars should correlate with this list. So I'm going to assume either you're thinking or these sound about right, and there's not a lot of opposition. Is there a general sense that these things, I realize they're broad, but I just want to make sure that these things resonate with you, and if there's something that you think is really missing, that we hear from you.
This is Julia in Alaska. How are you this morning?
Good. How are you?
Good. I just had a couple of comments. I really agree with the policy system and environment, PSEs. And so I'm looking forward to our August meeting so we can learn from those programs that received funding. I think there's been, for me, a missed opportunity to learn from those funded programs. I think they're the 1017s as fully as I could. So I think it's taking me as a program perhaps longer to get things like agendas and strategies set up than maybe other programs because I'm struggling to learn from what's worked for other places. Mm-hmm. I think for me, the community clinical linkages is a great opportunity to collaborate with our other funded programs around the chronic disease programs. I know our section is working very hard with federally qualified health centers and to develop those kinds of linkages in terms of screenings. And it would be good to hear in all of these areas. Again, I always like to hear from other programs and their successes so that I can adapt and adopt what they've done and what works. So those are the two ones that really jump out at myself.
So that's really helpful. I would add a follow-up question. In terms of learning from other programs, certainly the program director meeting will be an excellent opportunity for you to do that. What would be most helpful for you in terms of ongoing sharing of practices? Would you like those programs highlighted on webinars? Would you like us to do case reports? Would you like us to, write up a case report included in our newsletters? Or what kind of format is most helpful for you day to day to help with that ongoing feedback?
I think it's been really helpful to have, I know NACDD has had a series of webinars that's featured one of the programs. I think R2R is helpful. I think so. Webinar is really a good place to start. You hear more and more about community of practice. So maybe if there was an opportunity for, oftentimes we use the listserv to accomplish that. Someone will put out a question, like I put one out a couple of years, I don't remember when, so a couple of years ago about survivorship reports. And I got 6 different examples, and it was very, very helpful to see what other people are doing. So just a way to bring people together short term, not for an ongoing meeting for the next 2-3 years, but short term around certain needs.
Yeah, and I would offer that I've seen several of the sessions via listserv looking for examples of things with a promise to follow up with a summary of what the findings were, and if it would be helpful, we might be able to fill a gap by, the program that's bringing together those resources, if they need help summarizing it to put it in a format that then can be redisseminated to their peers, then that's something that we could help with if people are bringing together materials but just don't have time to format it and send it back out to the group. So
that would be great.
Yeah, that's another area to just think about if people pose questions, and clearly getting direct responses from your peers is great, but if you don't have time to do that summary piece, let us know, and we can, we're looking for ways to meet your needs in terms of the best format for this information. So any other feedback in terms of results that particularly resonate or specific needs for your program? So if not, I'm going to move on to the question about health reform technical support. We've heard over and over again through the survey, through discussions with individuals, key informant interviews, group discussions, that TA around the health reform and the Affordable Care Act is needed. However, we know that also is one of the top provided technical support resources. So we want to know, how could we best help you in terms of what do you need to know about health reform and cancer specifically, or what are the gaps that you're feeling still at sea, or things that we could create or put together for you that would be most helpful?
This is Katie from Kentucky. Can you all hear me?
I can. Hi,
okay.
Kate.
Hi. Yeah, this has been a huge issue here in Kentucky, and I like that you said that it would be helpful, especially at the state level, because it does seem to vary so specifically from state to state. As far as what would be helpful, what we're finding is people want to know the what now, like, so how is this going to change our constituents' daily life in some way? Is this opening some new door to them in health and well-being for cancer that in previous years has been shut? And so we've been trying to go through, to be honest with you, just with the highest incidence and mortality cancers for Kentucky to see if, breast, colon, lung, cervical, prostate, if there's something within those cancers coverages that are changing. And so I almost think that, and other states might disagree with me, it might be interesting to have, since you can't give a webinar necessarily for this is how it's going to change in Kentucky, this is how it's going to change in Nebraska, to do it by maybe like a national overview of what does this mean for colon cancer, or what does this mean for lung cancer. And certainly the specifics would be different from state to state, but it would be nice to know from federal ACA coverage how is this going to change an American citizen's daily life. And I think the best way to approach it, if you're doing it from a national standpoint, would be by cancer site. I'm not sure what others think.
Yeah, no, that's an interesting perspective. That's helpful.
Okay.
Hi, Katie. It's Polly in Michigan, and one of the things that we've been trying to understand too is even just with the preventive services that will be covered, according to the United States Preventative Services Task Force recommendations that have a grade A or B, how does that relate cancer issues and what folks would be able to access through commercial insurance? So understanding that, breast, cervical, and colorectal cancer screening is covered, but then realizing other issues like lung cancer screening, chemoprevention for breast cancer, tobacco cessation, what are the various preventive services, and I think it gets to the idea that you had for different cancer issues that people will now be able to access because of the bigger ACA covered preventive services.
Mm-hmm. And I assume it would also be helpful to know kind of what's different between, say, what's mandated for plans versus Medicaid, and if Medicaid isn't expanding, or I know that there are gaps in terms of certain kinds of coverage that may not fall under the ACA, and how that works, so that you would understand that. Do you guys have a sense of that, or would that also be helpful, like what's covered and what's grandfathered, and when there might be gaps and what to do then?
This is Julia again. Yes, that would be very helpful. It's also trying to interpret that for our survivors and for others that we are working with so that they can advocate for themselves. Because what we're finding is that there's a real lack of understanding by providers about coding and how to make that effective. So people are continuing to be charged for items that are supposed to be covered now. And it's very complicated beyond just this is now covered.
Mm-hmm. Okay, I'm just jotting that down. Okay. Any other feedback in terms of what specifically would be helpful for health reform technical support? We did provide a webinar in December that was highly attended. I think we had about 188 people, and that's archived on our website. We could also send out that link following the call so that if anyone's interested, they can access that. But would webinars on these topics, again, be helpful? We archive all of our webinars, so you can always go back and access them. Is that the most helpful format, do you think, or is there something else people would request?
I really think, this is Katie again, I think the webinars are really helpful, and because it's so, especially with enough lead time, notification of it, and also with discussion at the end. I know on one that I was on recently, people were making connections during the discussion and talking after the call, just because they've been able to share during the discussion time from state to state. So I think webinars are great.
Okay.
Hello, this is Stephen Garrett from Washington State,
Hi.
and I'm fairly new to this program and fairly new to cancer programming, and so my question might be a little naive, but I'm wondering, is there a listserv that connects all of the comp cancer directors and coordinators?
So there is a listserv that connects the program directors through the CDC, the National Comprehensive Cancer Control Program listserv, and you should be able to access that by contacting your program officer, who can make a request for you, or you may be able to contact the administrative officer directly. I think it's Mary, I'm forgetting her last name, Puckett, I think. So we could send out information on who to contact to request to be added to that listserv if you'd like. Would that be helpful?
That would be great. I guess the follow-up question is for my colleagues out there. Is anybody on that listserv, and is it functional?
I'll defer to your peers for that.
I would say yes, this is Julia. That's how I get answers to my questions in terms of what other states are doing and to get examples.
Well, excellent. That's exactly what I'm looking for the listserv for.
So we are also working on updating, or I know that my program officer at the CDC was working on updating the list to make that also accessible. So that we're going to try to increase how timely your contact information is and we're revamping our site right now to try to make that contact information more readily accessible to all of you, which I know has been a challenge in the past. So we're working on getting that list updated too, just so that you know who your peers are at a particular point in time and can reach out to them.
Well, that's perfect because, again, I'm new to cancer programming, so developing the network is one of the most critical things for me.
Sure. Great. And if you have specific concerns, we are building this expert database. What we've tried to do through this survey is identify where your needs are and where you feel expert, so that we can then match you either to experts or to peers who have experience in certain areas. So if you know you'd really like to talk to another program director who has a lot of experience in a certain area, you can also just reach out to us and ask your question, and then we can do some homework trying to connect you with a peer that might be helpful to you. So I would also offer that.
Okay, thank you.
Sure. And then another question I wanted to ask all of you, we are working currently on a resource guide on coalition structure, and I'm talking to a couple of program directors both about what they would need and what they would find helpful. I'm going to go back to our discussion slide here, but I wanted to ask, as we're working on this resource, what would be most helpful for you to be included in that guide? So some ideas that have emerged are different ways coalitions are structured, contact information based on structure, for example, who are nonprofits versus volunteer-driven, and what is the contact information for those two different structures. How is success measured? We're thinking, should we provide case studies of coalitions that are implementing cancer control goals successfully based on how they're saying they measure success? Should we provide case studies of sustainable coalition structures, information on how often coalitions meet and how, whether it's work group, committee, full membership, steering committee, how the work gets done, what the role of the department versus the coalition is, the health department versus the coalition, what the resources are for the coalition. So do they have a lot of financial resources? Is it volunteer-driven? Are there other resources? And the role of coalition leadership. So those are some ideas that have bubbled to the top, but I'd really like to hear from you what you think from that list or what's missing would be most helpful in this first resource guide. And if I did that too fast, I can repeat it. I apologize. Does that feel like a meaningful resource? So again, I'll just ask it one more time, and then you can, if any of you can give me any of your feedback. But what we're working on right now is a resource guide for coalition structure, and we want to know what would be most helpful to you. Either some of the topics that have bubbled up are different ways that coalitions are structured, contact information for coalitions structured in specific ways, how success is measured, case studies of coalitions successfully implementing their goals, case studies of sustainable coalition structures, frequency of meetings and how meetings are conducted, whether that's full group membership, steering committee, work groups, how work gets done, whether that's through work groups, action plans, the role of the health department versus the role of the coalition, the types of resources available to the coalition, human or financial or other, and the role of coalition leadership. Do those sound like solid ways to structure this? Is there anything missing, anything that you don't think is as important?
This is Julia. It's a little bit hard to respond without, I need something more visual, but just a general response is, while it would be interesting, in my work, I'm not sure I would be using it right now.
Okay. So maybe a time point issue during transitions or... Okay. That's helpful.
Yeah, Julia, this is Katie. I agree. I think that it would be really helpful probably for new folks who are, or people who are in that transition of, well, we're starting a 501c3, we really need to know how to structure this, how to do this relationship well, that would be helpful.
Okay.
And
we'll keep that.
This is Polly. I was just going to say as well that for turnover in staff, like was already mentioned, if you have new folks coming into the program that are leading it, that sounds really helpful. And I would just also say, if you are considering doing something like that, it sounded like an awful lot of topics.
Yeah.
And that anything that's long is just, it's hard to take time to read it.
Actually, that goes to my second point. What would be, I was thinking of kind of a PDF resource guide, but would it be more helpful to have a web page with links, or what would be most helpful if we're creating these guides in terms of format?
I think, it's Katie again, I think a web page, because that way you could update it really easily, and it's easy to maneuver around, and you could have sections that you are directed to if you click on that topic category down the page. We've, just from our own internal, we found that to be really the easiest way to get the word out, and for whatever reason it seemed less intimidating than clicking on the PDF and opening it and scrolling through to find what you need.
Yeah, that's interesting. Do others feel similarly? Would a web-driven resource be more helpful than a PDF guide?
This is Amari. I definitely think a web resource guide would be really helpful. It's somehow easier to find than having a PDF and then having to save it or print it out, and you can update it with additional information. So it seems much more fluid than sort of a static PDF.
Awesome, thanks. Well, I want to be respectful of your time, and I appreciate so much all of you calling in. It's a privilege to be able to work with all of you and learn from all of you. So I would welcome any questions that you have, any other feedback you want to give us. We're really excited about this project. We have a great team here that's committed to being helpful to all of you, and I appreciate all of your support. We are going to try to focus on a few things so that we do a few things well, but we are going to prioritize this list and try to get through as many things in the most useful way we can through the course of the project. So do you have any questions for me or any other feedback you want to provide us?
No, thank you for this call. This is Katie. I was just going to say one other quick thing that's always helpful, and you mentioned it already, but just to reiterate it, is you mentioned it in context of when people respond to the listserv and summarizing information, when that would be extremely helpful. And also just almost on any of the topics that you mentioned providing technical assistance on, like the ACA and cancer, any kind of like compilation that summarizes things is super helpful that we could then tailor to our needs and our state specifically.
So I would just welcome you then. I know that some of you have, I don't know if those of you who have posed questions on the listserv are on this call, but if you are and if you're sitting there with 6 or 20 documents and you just don't have time to summarize it, I put up on the screen our email address for the project, which is cancercontrol@gw.edu. If you would like us to support you in this way, we would be happy to do that. Just send us what your question was, what the resources you've currently gathered. We can create a summary compilation. It may also help us with our larger efforts to provide ongoing technical support, which is great. And we may, for example, if there's something relevant to a project we've already proposed, we may provide a rough summary to get it out to you sooner and then work on formatting and refining the actual guide or product that we want to deliver that's more of a permanent resource for you all. So go ahead and send information to that. If we can be helpful in that way, we would love it, and you would also be helping us really get in tune with some of your needs so that we can be more helpful. So that would be great. Any other questions? I'm going to go ahead then and conclude the call so you can sign off. And if you need to reach out to us at any time, contact us at cancercontrol@gwu.edu. We will follow up with you and send out a link to our archived ACA webinar, as well as contact information on how to get on the CDC listserv for comprehensive cancer control so that you can make that request. And we will send a link to this webinar as well if you want to share it with any of your colleagues. So thanks again, and we look forward to working with all of you in the future.
Thanks so much.